Welcome to Getting Your Dream Smile with Cosmetic Dentistry. This is where we discuss and help patients get what they want in a smile while being totally informed. Whether it is porcelain veneers, bonding, whitening, or Invisalign, you'll find out what is best for your situation. Everything you should know, where and who to see, and all the costs involved. Stay tuned.
Welcome back to Getting Your Dream Smile with Cosmetic Dentistry. I'm Sabrina, your co-host for today, and I'm joined with Dr. Eshom and Dr. Ta, and today we'll be talking about whitening and all about what you should do when you want to consider whitening your teeth.
Today, we are lucky to have Dr. Ta with us. She's a cosmetic dentistry resident here in our office, and she comes from San Jose, but I thought I'd have her tell us a little bit about herself and her background before we get into, how white do you want your teeth subject?
Yeah, so I'm actually from Iowa. I was born there, and I grew up pretty much in San Jose. I went to dental school at UCLA and went back to San Jose to practice for a few years, but kind of craved SoCal life. And so I'm glad I met Dr. Eshom, and I'm glad that I'm here in San Diego.
Yeah, she's very talented, young dentist, has a great eye for aesthetics, and she's just killing it here in our office.
Perfect. All right, so do you want to get started with our topic of the day, Dr. Eshom?
Yes, the topic is how white do you want your teeth? And then how do you get them that way? And so we're going to talk about that today, all the different ways and all the different things you have to think about when you think about how white you want your teeth. And so we're going to start with Dr. Ta, and she's going to talk about the simplest and easiest and most minimally invasive way, which we all like to think about, and that is bleaching your teeth. So I'll let Dr. Ta go over the possibilities with bleaching your teeth.
Yep, so bleaching your teeth is simple as getting bleaching solution. So there's two options. One you can do over the counter, and there's another option where there's in office or the prescription dental whitening. So with that being said, now in office is our preference. The reason for that is because a lot of the over-the-counter options usually are presented as strips, and they don't go all the way to the back. So if you have a pretty broad smile or a pretty wide smile, you can't really bleach those teeth back there. Now, another thing that we're concerned about is saliva contamination. Saliva contamination kind of prevents the medication or the gel to really penetrate through your enamel, and thus less effective. So the options that we have here in office are either the at-home bleaching trays with the gel, or you can do it in office. So those are our two options, and it is the least invasive, I would say, way to get your teeth whiter. But with that being said, there are some limitations. So yeah, we're going to talk about that.
Great. So those are the options. But tell us, who does it work for? Are there any concerns that patients have when they do it? And when is it better not to bleach?
Good. So those are great questions. A lot of times there will be a patient that will present with dark teeth. And now when we see dark teeth, we have to look at the overall tooth condition and why it's dark. So there are some factors that can account for that. So one could be a health condition of the tooth. So say if you had a root canal treatment, which means that the nerve is no longer alive, and that can discolor the internal part of the tooth. Now, other things that can also affect the internal staining of the tooth are something that we call like tetracycline staining. So that's usually like an antibiotic that you may take when you're younger, and during the development of your teeth, it tends to just kind of catch on to those stains. So with those conditions, it's really hard to just bleach and whiten your teeth and have those stains go away, because those are more internal. If there are external stains like coffee stains, plaque stains, things like that, then bleaching can help with that. So those are kind of the two ways, or two conditions of which one can work and where the other cannot work.
Yeah. No, yeah, as you know, Dr. Ta, getting a patient who comes in with really nice teeth, but the one problem they have is they fell down and they needed a root canal on their front tooth, and that tooth is dark, and all the rest of the teeth are somewhat normal shade. What would you tell a patient like that?
So for patients like this, I typically tell them that we will kind of need to do something else besides bleaching, because obviously bleaching at this point will not do anything. Now, we have two options here at our office. One is the Bioclear method, and the other would be porcelain veneers. So there are different techniques to both, and depending on how or what type of result the patient would like, those are probably the two other options to get their teeth to match.
Yeah, it's a real difficult thing, and one of the hardest thing in cosmetic dentistry is to deal with one front tooth, when they're regular colors. But when one is dark and all the rest of the teeth are not, that takes a lot of talent. But we do accomplish that and are very successful here. But it takes a lot of forethought and a lot of training and a very talented lab to do those kind of cases. So for all you out there that might have that single dark tooth, I would recommend that you look for a very trained cosmetic dentist when you're trying to treat that one single dark tooth. So what questions do you have, Sabrina?
Yeah, I do have one question. So let's say there's a patient that comes in and they say, I drink a lot of coffee and wine and tea, and so things that stain my teeth, but they want to get like one Bioclear in the front. Would you consider other treatment options because they're more prone to staining and over time the tooth wouldn't match the rest of their natural teeth color? Or how would you deal with that situation?
So you're saying that a person has a lot of stains in their teeth already.
Mm-hmm. And they would be prone to continue getting
those. Yeah, that's a tough one. You'd probably want to do more than just one tooth.
Okay.
You might want to do 4 teeth, or you might want to do 6 teeth, or even 8 teeth. But it might be that they have like irregularities in their enamel that makes it rough, and then that will stain. Or it could be that they've had some gum recession, so their gum moved away from their enamel and there's just root showing.
Oh.
And then the root stains more than the enamel stains. Mm-hmm. So those kind of situations we have to look at individually, but more than likely we're going to be covering the tooth somehow.
Mm-hmm. Gotcha.
So let me go over a recent thing that came up in my office, because one of the first things Dr. Ta and I ask our patients when they come in for a cosmetic consultation is, like, how white do you want your teeth? And so some people want it natural white. In fact, most people want them natural white, but there's other people that want them white. And so with those patients, the first thing we think about is whitening, of course. But in most of those cases, that's not going to work because the patient who wants the white teeth already whitened. And so then Dr. Ta and I need to look at their teeth in terms of how dark are they and how white do they want them. And so there's a couple of different options that we have with that. And I'll let Dr. Ta talk about like kind of the medium option with somebody that have whitened their teeth, but they're still not happy with the color. And what would be the most conservative way to handle that, Dr. Ta?
Yeah, in our office, we offer Bioclear, and Bioclear is a great method to be where we can be less invasive and be a little bit more conservative in that whenever there is a darker tooth, if we can just add material to the tooth to kind of enhance the color, but also cover up the old color. So with that being said, the Bioclear method is mostly additive. We're not really taking off too much tooth structure if we don't need to. There are certain situations where we might, if, for example, the tooth is sticks out a little bit more, or it's in a poor position. There's a lot of different scenarios, but for the most part, we try to be very conservative with it, and it's ideally more additive. And that's the most conservative way for us to kind of change the color of the tooth. Now, there are limitations. We can't go from a really dark tooth to a very, very white tooth, especially if they were root canal treated or have this tetracycline staining. There are probably other options that will be better in those scenarios. And
yeah, so that's kind of the medium option where somebody just wants to get their teeth a little whiter. Maybe they're in their 50s and they've whitened their teeth, but they're still not white enough. The Bioclear option's a great option to get them out a little bit whiter. But if you want the white teeth and you're in that situation in middle 50s or 60s, then and you really want white teeth, we have to analyze where you are and then where you want to be. And if you really want to be white, then we're going to need to do something that's a little better at covering that darkness and still giving you a natural look. And that would be porcelain veneers. Now, we try not to do porcelain veneers because, again, our philosophy is conserving tooth structure, but there's just some people that want those white teeth and have dark teeth. And so porcelain veneers are the best way to cover tetracycline staining or cover roots of teeth that are really, really dark, and you want that real pizzazz white smile. And so that is a great way to do it, but it does take, some of your tooth structure away. And again, you want to only take the amount of tooth structure away that you need to get that whiteness. And so that calculation and that planning by the cosmetic dentist is very important because tooth structure is precious and we only want enough to get you the white and we don't want to take any more than that. But those are kind of the three ways to get your teeth whiter. The bleaching with Bioclear and then with porcelain veneers. And generally those options will get your teeth the way you want them in terms of whiteness goes. What other thoughts do you have, Dr. Ta?
I don't have any other thoughts here besides saying that all of these options are great. And I think for everyone out there, always start with the most conservative and then kind of work our way through. And if that is the case where we need to do porcelain veneers, then that's a great option as well.
Yeah. And Sabrina?
I also don't have any other further thoughts. However, one quick question I did have was, what is the translucency of Bioclear? So like how much of the natural teeth can you see if you put on Bioclear?
Do you mean in terms of blocking out tooth structure?
Mm-hmm.
Because, so Bioclear has medium translucency. So when we want to take a medium dark tooth and make it white, not white, if you can imagine what white is versus white. I know it's hard for you to see it. I can't show that to you. Then you could pick a white, ultra white Bioclear shade and you'll get medium white. But if you want to go from dark to white, then that's where porcelain has more opacity in it, where you can block that color. And then porcelain has a way for us to build in the naturalness and the colors of a tooth and still have it look natural. But with Bioclear, technically, you don't have a lot of control of the translucency. And so you have to block out dark teeth by the thickness that you put on the tooth to block it out. Whereas porcelain, you can block it out in it with a thinner layer. Mm-hmm. So that's where if you tried to do that with Bioclear, the teeth would just be too thick and look unnatural. So.
Perfect. Well, I think one thing to stress is that if you are looking into whitening your teeth, you should look for a cosmetic dentist who will provide you with all of these options, such as whitening, Bioclear, and porcelain veneers, so you can really understand what is the best treatment plan for you. Like we have gone over, there are so many different types of cases, and of course, we all want you to get your dream smile. So be sure to look and do your research on a cosmetic dentist who will provide you with all these options.
Yep, the experience and expertise is very, very important when you want a nice smile. Any thoughts on that, Dr. Ta?
No.
Okay. Yep. Well, it was very nice having you on the podcast today.
Thank you.
Thank you for joining us, and good seeing you, Sabrina.
Yeah, good seeing you too.
So everybody out there, have a great smile. And if you don't have one, look for a cosmetic dentist to help you with that.
Perfect. Well, thank you guys so much for listening. Thank you, Dr. Eshom and Dr. Ta, for joining us today and sharing us your amazing knowledge. If you have any questions for us concerning your teeth or any questions concerning cosmetic dentistry, please feel free to click the link in the description and you can ask us a question through the form. Other than that, you can find us on Spotify, Apple Podcasts, and the video recording on YouTube. Stay tuned for the next episode and we'll see you guys soon.
Thanks.
Bye, everybody.
Thank you for tuning in to Getting Your Dream Smile with Cosmetic Dentistry with Dr. David Eshom. Be sure to subscribe to our podcast to be notified about future episodes. Click the link in the description to fill out a form if you have any questions on cosmetic dentistry or your smile that you want us to answer. See you next episode.